Hi there, I'm Samantha Shatsky, and welcome to Body and Health.
A portable history.
It's like carrying around really the virtual hospital record with you.
How a tiny CD could save your life while away from home. And meet Cuddles, a tiny but incredibly helpful horse.
Imagine being taken to a hospital in a foreign country, unconscious, where nobody knows anything about your medical history. It's frightening, but it happens all the time. Because of this, some doctors are now offering patients a digitized medical record on a mini CD that fits right into your wallet. And as Allison Ansley learned, it can be accessed immediately in any emergency.
Now, do you have a toast for me? Okay.
Jeremy Beatty takes his health seriously. As a liver transplant recipient with diabetes and hepatitis C, who has also had bypass surgery, he has to.
Everyone got something? Mm-hmm. All right.
On a recent trip to England, Jeremy realized the importance of being able to access his complicated medical records.
And I became ill, and I had no medical records with me. And it was very difficult to get treated.
Despite hospital treatment, Jeremy never did feel better during his trip. But that was before Jeremy put his entire medical history on a wallet-sized computer disk called a LifeLineCD.
It's not that I didn't have faith in the English doctors, but they knew absolutely nothing about me. And so it didn't instill confidence that I was being properly treated.
The LifeLineCD is a new product being offered for a fee by healthcare providers, like Ontario's Trillium Health Centre, to help patients help themselves. These small, portable, accessible CDs typically cost $25 each and also include customized medical reference information. Cardiac surgeon Gopal Bhatnagar thinks the LifeLineCD is a tremendous resource.
Hi Gopal, how are you doing?
I'm fine, how are you?
Good.
What do you have for me? It's like carrying around really the virtual hospital record with you. And so for that reason, I think that it's very attuned to cardiac patients. Because if things aren't managed correctly in a very short period of time, then it can lead to a catastrophe.
You just take this small CD and you put it into virtually any computer with a CD-ROM drive anywhere in the world, and you put it in and it starts, it's self-initiating. It comes up on the screen, and there's your medical record.
And the time doctors save trying to glean an accurate medical history from patients can be spent on other priorities, like patient counseling.
The time pressures on healthcare providers is such that this may well allow us to see more patients in a given day without sacrificing that quality of intervention. And even decreasing a waiting list, waiting time by even 5 or 10 or 15% in many specialties really improves the efficiency of our healthcare system.
Hypothetically, of course, medical records could have been made accessible on the internet, but this mini CD is designed to protect patient confidentiality. So as a result, the onus is on the patient and their healthcare provider to make sure that the information stored on it is kept up to date.
And there's an exact ECG chart as it's printed out and scanned in.
Updates are available from the same healthcare providers who create and sell the LifeLineCD. So the product is being marketed to hospitals and larger doctors' offices with electronic patient records.
So for unusual medical conditions, and even the physician could learn something here.
Absolutely. We looked at the critical diseases in North America being asthma, allergies, diabetes, and heart conditions. And when you add those all together, approximately 1/3 of the North American population suffers from those diseases, any one or multiple of them.
For people who like to travel, even those in good health, Lifeline can offer peace of mind. Certainly Jeremy felt a lot more confident on his last trip, a Mediterranean cruise with his wife last summer.
I felt extremely comfortable that in the foreign countries that we visited, that that my LifeLineCD would be universal, because if I was at a hospital, I could, if they couldn't, put it into the PC and they could see my whole history. To me, it was very much like insurance. I felt as if I was protected in the event of some calamity, which fortunately didn't happen, and that's what insurance is all about. Okay, here we go. This looks delicious.
And Allison Ansley joins us now in the studio. Allison, is a patient's medical record the only thing you can access on the CD?
No, it's not. It's actually a very valuable medical resource. You can access medical textbook information that is specific to you, and that can be a very important feature if you suffer from a particular medical condition but you're being seen by someone who doesn't have a background in that area. And some other information that's included on the CD includes medications that you can and can't tolerate and dosage guidelines.
Wow, that's amazing. Now, who would want to carry this? Would it only be people with chronic illnesses?
Well, people who travel, professional athletes who need a record of past injuries and treatments when they travel, students who are studying away from home, and really anybody who wants to be proactive about their health, because a healthy person can also end up in an emergency room unconscious. So for that reason, it's suggested that you carry the LifeLineCD in your wallet with your driver's license so that it can be found easily, and then it can be accessed on any computer in the world that has a CD-ROM, and it's self-initiating, which means that the information comes up on the screen automatically, the essential information like your blood type, drug allergies, and anything that medical professionals would need to know in order to treat you.
It really is a great idea. Now, in your story, you said that it costs $25. Is that a flat fee? Just a one-time only thing?
It could be a flat fee. That's really up to the healthcare provider. That's just a guideline suggested by the Statum Group, which is the company that markets the LifeLineCD. But healthcare providers actually keep most of the profit, so it's also a revenue-generating tool for hospitals and for doctors.
Okay, thank you, Allison. Good story. That's Allison Ansley. Well, in the past 5 years, prescriptions for antidepressant drugs have shot up more than 60% here in Canada. When we come back, we'll examine how real the demand is for antidepressants. Stay with us. Body and Health is back right after this.